and welcome to Intuitive Journey with Desiree. I am Desiree Holmes Scherini, your host. And in today's episode, I just wanted to share some information that's pretty practical that maybe some people might have a question in their mind if they're looking for some assistance with their personal life, moving forward or dealing with some issues. And it's about what is the difference between, say, a therapist and a life coach primarily. And then I'll also get into what's the difference between a hypnotherapist and a hypnotist. So basically, I'm going to start with the basics. Basically, I'll start with the basics. A therapist is generally someone who has an advanced degree, at least a master's level degree. They may be a psychologist, a social worker. They may go by the title of therapist, psychologist, social worker, and MSW, which is Masters in Social Work. And they're also in almost everywhere in the US, I believe, they have to be licensed and then have state boards that they have to, report to, be under, keep up a certain number of hours of education and that sort of thing. And most of them, if they choose to, are able to take insurance because of the licensing. Okay. So that's that part. Okay. Then a life coach. And in most of the US, just about anybody can say they're a life coach. They don't need to have any certification, license, education. They can just say life coach. And so and most of them do not take insurance because they are not licensed professionals under a certain level of board, state board or anything like that. So that's one difference. And I'm sharing this so that when you are looking to work with somebody, both therapists and life coaches, they have a lot to offer you, but you want to look into what are their qualifications, okay? So that's one thing. With a therapist, you're more likely to find built-in qualifications because they are likely licensed. And you can probably search for any complaints, reviews and such. You could probably find reviews online for life coaches as well. Okay, what's the difference in approach between a therapist and a life coach? The core difference is that the focus of someone who's a therapist, again, psychologist, counselor, social worker, is that they may more likely be focused on why the issue is an issue. Where did it come from? What's the source? They may focus more on things like anxiety, depression, PTSD, deeper rooted traumas, okay? And their approach is often talking it out, getting in there and just, and it may include some going deep and rehashing, say, childhood or past events and looking for some insights that can help the client, and in their case, they might call them a patient, but helping their client find some information about why they're having the problems they're having, and from there, perhaps move out of those. Okay. Also, with therapists, many times someone will have a therapist for their whole life or go from one therapist to another. Therapy may be a continual thing, an ongoing thing without a definite, say, oh, we started, now we're finished. That's not necessarily a definite end goal, but rather as an ongoing support for even just dealing with weekly or their daily life, as to somebody goes in and rehashes and kind of gets some feedback and emotional support possibly on how they're dealing in life. A life coach's focus is generally more focused on somebody who has reached a certain sense of equilibrium. Their life is in, pretty much balance, and they are wanting to move to that next level up. So a life coach focuses more on goals, more on motivation, more on gearing, honing in toward steps, like the how to more than the why. So the how do I move from here to there rather than why am I like this from that? Okay. Um, that being said, those two areas have a lot of overlap. Okay. And it depends on the individual therapist or life coach. I talked about certifications, licensing as well. There are definitely many, many certifications for life coaches. And so, like I said, a life coach doesn't have to have anything to say they're a life coach and have clients. However, there are many fairly well recognized groups that do education for life coaches and have certifications. Okay. And so when you're searching, you might want to look at the qualifications again and say, where have they been qualified through? What certifications do they have? What sort of training? Because that does certainly make a big difference. Now, some overlap occurs when it comes to specific methods. All right. So a therapist, for example, when I Googled therapists, what types of therapists are there, came up with more than 20. And I'm sure there's many more than that because I came up with the same number when I asked about life coaches to put into an article that I'm writing that will be attached in the details below, and for this as well. So there's therapists. There's anything from family and marriage counselors to EMDR. That is a process. However, I've had a workshop in EMDR as a hypnotherapist. I understand how it works, but you get certified in EMDR, and according to the Association for EMDR, you should be a licensed therapist to actually use it. And there's some machinery that goes with it too. So that's a little different than the hands EMDR, and that's a whole I don't even want to bother explaining what it is right here. Just as an example of the trainings are available even to non-licensed people. You can get certified, but perhaps you're not supposed to use it without being a licensed professional, or you can be certified in all sorts of stuff, and something that a life coach might do, a therapist can do as well. Okay, so there were things for therapists. There was, like I say, family therapy, individual therapists, you name it. I'm going blank now. But quite a list of specialty therapists. Okay, and now jump on over to the life coaches. Every kind of life coach you can imagine, probably even more than therapy specialists. So anything from a financial life coach to a business life coach to a relationship life coach, spiritual life coach, to a meditation life coach, mindfulness life coach, and the list can go on. Okay, so however, say there's someone who's a holistic therapist, for example, someone who is, not just purely clinical, but maybe embraces the more alternative approaches or a more holistic approach, may become certified in meditation or mindfulness and use it in their therapeutic practice. All right. So a therapist focus primarily might be with someone who's struggling with some mental health issue, like I said, depression or anxiety, heavy stuff that is preventing them from even maybe functioning. Okay. Whereas the focus of a life coach is to go from functioning to optimizing, what the person would like to work on. Now, since I'm a hypnotherapist, I have to throw in what's the difference between hypnotist and hypnotherapist. Okay, both a hypnotherapist and a hypnotist can hypnotize people. However, a hypnotherapist is trained to use hypnosis in a therapeutic way. And that may mean to help with things like anxiety. You know, I'll give a list of some common things that hypnotherapists work with. Say overeating, stop smoking, behavior changes. It may deal a lot with behavior modification, CBT, cognitive behavioral therapy. And, that's something I'm certified in as a life coach. But it's also something that is in the realm of therapy as a mainstream use. Relationships. I get a lot of people that are dealing with relationships, and the overlap with my work, for example, as a hypnotherapist and life coach, it kind of gets meshed together, is calling on a little bit of what's the source, like a therapist might do, of someone's problems with their relationship, okay? And helping them identify that, moving from there, as a life coach would help you move from there to your ideal way of being in relationships. So you come out with a better understanding, and then using hypnosis, once we know, what the clarity of the desire is, to help put that in the subconscious and have the person operating on that level toward optimization. And now that I say that, there's a part that I also want to add. Another area of life coaching is that it's not that just somebody comes in and says, I want to fix this and I want to fix that, or I'm having a problem with this and I want it to be better. A lot of people come to a life coach in search of clarity. They don't know what they want. They know something's not quite right in where they are in life, but they're not sure of the direction they want to go. So they don't necessarily need therapy. They're not depressed or anxious terribly, right? They're functioning in the workplace and in their relationship, but they feel like there needs to be something more. And so there with the life coaching, and I can help, or a life coach can help somebody hone in on what's important to them, what their priorities are, what their heart's desire is. Okay. And then from there, if someone chooses to use hypnosis to then anchor in a goal setting for that. So a life coach might first ask you, okay, what's your goal? And a therapist might just be saying, how can I help you? Okay, both are very similar, but life coaching is more goal oriented and therapy is more bringing someone up to the point where they would even know what their goals are, okay, where they are even ready to start moving forward with goals and with motivation toward, optimization. Now, I can't leave out, I forgot about certifications. Okay, hypnotherapists and hypnotists, it varies state by state, whether or not you have to be certified or licensed with the state. Okay, some states yes, some states no. And again, the training is widely varied. Just like life coaches, somebody can say, they could say they're a hypnotist or hypnotherapist. They could call themselves that with no training, okay, depending on the state. However, because I'm bothered to go through the training and keep my training up to date, and I also train others, I would warn you, knowing what I know, to choose somebody, if you're going to be using a hypnotherapist, who has a certified training that is up to date. So similar to the mental health professionals of therapy, a hypnotherapist should have a overseeing body or board that has some form of regulation expectation of continuing CEUs, membership, and keeping up with their qualifications. Okay, as opposed to somebody who learned how to hypnotize from a YouTube, 5 years ago, and now they are practicing. So they're when you're working with someone's subconscious, it's really important to be careful who you're working with so that you know that they are trained about what they're helping put in there. Okay. So there is training. Now, I really didn't go into hypnotists too much because it's similar. Hypnotists hypnotize, hypnotherapists hypnotize, but hypnotherapists help therapeutically with bettering somebody's life. Now, let's move to the straight hypnotist. You know, the street hypnotists or the entertaining hypnotists, okay? They may have also have a practice where they help people with, more therapeutically, but many of them are strictly entertainment, and they are just there for people to watch. They're the onus for them to have, higher qualifications is not as much as, say, a hypnotherapist who's working with you to help you with, say, an emotional state or behavior. So that's when someone, say, is a hypnotist. You go to a hypnotist show and you see what they do. And also, that's unfortunately, a lot of people have seen a hypnotist show or they've seen a movie where someone's hypnotized. And that's where some of the, I would say, misinformation about hypnosis comes from. And people might get a little wary, thinking that they don't want to go to a hypnotherapist or what's going to happen if I get hypnotized. But it's being hypnotized in a hypnotist show and going to a hypnotherapist for help are very much two different worlds. So there's that part. And I cannot leave off without addressing psychiatry. A psychiatrist is a mental health professional, but also a medical doctor. Okay. And so their focus would be to deal with people that have more diagnosable issues, like out of the DSM, like borderline or schizophrenia or something, that's the step up from what, say, a therapist would help with. Okay. And their focus is also, like I said, maybe medical, and they will more likely use medication to help their patient. And they would definitely be calling someone their patient more than their client, okay, because they are a medical doctor. So they more likely manage symptoms and behaviors and issues with medication for their patients, rather than, say, talk therapy or behavior change therapies, or move on down to art therapy. Some of these things might overlap. They might incorporate those. So it's, these things, they kind of are like this, therapist, psychiatrist, life coach, hypnotherapist. There are overlaps, but they are distinct and each serves its own purpose. I personally have had many clients who have had therapy and then come for hypnosis. So they worked through some stuff with a therapist. And maybe there was stuff that just still lingers because it's still locked in their subconscious, some old thought habits that are not easy to let go of, no matter how much therapy happens. Okay. So they've found hypnotherapy to help cut that tie and make that more permanent thought change subconsciously and move forward. I also have clients who currently see a therapist and then also come for hypnosis to, to get both parts of what they're working on. So it's not an either or, it can be both. And I hope this infomercial, I hope this information helped you to get some clarity on what the differences are, and when you are out there looking for some help in your personal life, as far as if you're having issues or if you're wanting to set goals, that this will give you a starting point. Always check somebody's qualifications. If you're able to, if they're at the higher, level of licensing and stuff, you can probably check for any complaints, and, go from there. Anyway, wishing you luck, and thank you for being here. Bye.